during Panchakarma, the diet plays very important role because this diet definitely it is required and because it enhances the therapeutic value and also mainly it supports the digestion or Agni. So in our Ayurveda, Agni is one of the main core thing which is explained in Ayurveda. So for all the diseases, Mandagni is the root cause, as everyone know. So here to maintain that Agni, so this diet plays a very important role. And diet even not only supports the Agni but also prevents the complications after the Panchakarma therapy. So in this regard, let's understand the importance of diet in Panchakarma. So as I mentioned, so here diet definitely helps in maintaining or stimulating the Agni because immediately after the Panchakarma, there is a declination in the Agni. So we can say it is there when the Agni is present. So to maintain or to stimulate the Agni, the diet has to be maintained or it has to be advised properly. So thereby, even in prevention of armor formation also, this diet is very important. And apart from this, the diet definitely aids in elimination and tissue nourishment. So even though after Panchakarma, if there is any dosha which is left, so even it helps in eliminating that dosha. And also it nourishes the dhatu or tissue nourishment takes place. And also with that, the diet also helps in maintaining or balancing the doshas altogether. So this is how diet is very much important in case of Panchakarma. So as you know, the Panchakarma are five, which are uh, Amana, Virechana, Basti, Nasya, Raktamokshana. In all this type of Panchakarma, let us understand how we can advise in each of these therapies. It is not only everyone thinks that only diet is required for Omana or Virechana, but definitely along with Omana and Virechana, other therapies also require the diet advice. Let us understand the stages of Panchakarma. So when we say stages of Panchakarma, so definitely it is divided into three. One is Pura Karma, that is the preparatory stage. Then Pradhana Karma, which is the main Panchakarma procedures which we advise. And next is Paschat Karma, that is after the therapy or Panchakarma, post therapy, which is usually a rejuvenation therapy. So each phase has its own dietary guidelines. So whether it is in Pura Karma or in Pradhana Karma or in Paschat Karma, so the diet has to be followed. Okay. So diet is the main key which helps in maintaining the Agni, whether it is in Pura Karma or Pradhana Karma or even Paschat Karma. Even after the main procedure also, for some days, okay, according to the uh, therapy or the effect what we get. So based on that, even the Paschat Karma, after which the diet has to be advised. So let us understand what are the diet during Pura Karma. So as you know, during Snehana, so as a Pura Karma in any of the two therapies, whether either it is Vamana or Virechana, so Snehapana is done. So Snehapana, during Snehapana, what type of diet should be advised? So it is day by day. See, when you advise Snehapana, definitely the diet which we advise should be light, warm, okay, and also one should avoid heavy foods or fried foods. But in this Snehapana, on the first day, what should be advised? Second day, what should be advised and when it should be advised? Likewise, day by day, if you think of Snehapana in either Vamana or Virechana, okay. So in if I say Vamana, usually nowadays even the Snehapana is done for only 3 days, but it is not so. It can be extended up to 5 days also. So practically, it is first day should be considered as the test dose day, but second day has to be considered as the first day. So if it is continued like that, definitely Snehapana will have its good effect. Snehapana, when you advise for the first day during uh, the the day where it is the test dose day. Okay. So Snehapana, when you advise. So in this Snehapana, in the first day during morning hours. So definitely it should be a light one, but any sort of normal light food which contains mudga as well as shali. It means green gram as well as rice can be advised. So like the preparations we usually call it as kushara or khichdi. So that can be advised during the day in the afternoon. In the morning, light diet or even the uh, breakfast that we take can be advised because as it is a snehapana as a trial dose. But in the likewise 3 times the diet can be given in the morning even after having if the patient feels hungry. Okay, so if the patient feels hungry, definitely during the first day of snehapana you can advise the patient to take light food. Likewise in the afternoon it can be with the normal diet, that is a roti or chapati, then with sabji and then rice or rice and sambar. So likewise in the afternoon, in the it is for the only first day that I'm telling. Okay. So likewise on the second day, as it is the dose is increased in the snehapana. So this snehapana, I hope in the panchakarma it is for whether it is for vamana or virechana, it is same snehapana. So in both the conditions, the diet during pura karma in the snehapana remains same. Okay, so here for the first day normal diet, but in the second day, first in the second day when the dose is increased, definitely one should not advise them to take breakfast. They have to skip the breakfast. But in the afternoon and in the night, the patient, if he feels hungry, so he should consume diet. And you should ask the patient to consume always the warm water during snehapana. See, even warm water is also a diet which we have to consider it as a diet. Okay, so the patient should drink hot water all the time, be it a morning or afternoon or in the evening. So he has to consume warm water, or we can call it as even hot water itself, like how we drink the tea. In the same way, it should be you should ask the patient to drink hot water. Then, as I told you, in the second day, the patient should skip the breakfast, but he can have lunch or dinner. And then in the second day, I mean to say, after the test dose, if it is skipped as a 0 day, then first day will be where the breakfast is skipped. The second day, when you again increase the dose, so definitely you should ask the patient to skip the breakfast as well as the lunch. Lunch can be later at whenever he feels hungry, and only night or in the evening the patient can have light or warm food during the second day. And third day, definitely only single meal has to be advised. So because as the dose is very large or heavy, so it means maybe around it can be 100, 120 or 130 or 150 in the third day. So depending upon the patient, when the snehapana is advised for a larger dose, then definitely they have to skip the breakfast as well as lunch. Only in the evening, if the patient when the patient feels hungry during snehapana, usually the uh, burps which come when the hot water is drunk. Okay, so there he should not have any taste of that snehapana. So till that he should consume warm water. So later when he feels the clear belching, then only the patient should be advised diet after 1 hour or so. So this is a snehapana. During snehapana, the diet should be advised. And after after the completion of snehapana, during Vishramakala, that is in Vamana usually less Vishramakala is given. That is only for 2 days. Whether in Virechana it is 3 or 4 days. So, or sometimes even to some patients in Vamana only 1 day as Vishramakala. So their Kafakara Ahara should be advised so that Kapha will increase in the body, and on the next day of Vamana definitely the kapha will be omitted. So this is how kapha yukta ahara should be given. So like rice with curd and sweets, added with sweets, either it can be jalebi or any peda. So likewise, where madhurata is more, so likewise the patient should be given kafakara aharas, the one which increases the diet which increases kapha should be advised in case of vamana. But whereas in virechana during vishramakala, definitely it should be lighter, but as the normal diet that we consume for breakfast and lunch and as well as dinner. In the same way, it can be advised. But during Virechana, as Vishramakala is more, as Vishramakala is more, so definitely normal diet can be advised, not Kafakara Ahara or Pittakara Ahara. Some do explain it as Pittakara Ahara should be given. But in my practice, I have seen Pittakara Ahara, if you are giving uh, the Lakshana only in Amla Pitta, if it is present, then only it may be helpful. But in other cases of Pitta disorders, it will definitely be not helpful if you give Pittakara Ahara. So definitely don't advise any Pittakara Ahara like as in case of Vamana. So we should not advise any Pittakara Aharas during Virechana. So this is how the diet during Purakarma has to be followed for an individual during Purakarma, that is Snehapana or Svedana. In Svedana, liquid diets can be advised. As in Svedana, as I told you, after Snehapana, Abhyang and Svedana will be done during the Vishramakala. So, in this, liquid or food like Yavago or Manda can be advised. Next, diet during Pradhana Karma. So, for example, in Vamana, so as I told you, that is Mandapaya, which are having Madhurata can be given, but after Vamana, the Samsaja Krama is very important in case of Vamana as well as Virechana. But in Basti, it is not so. The diet during Basti, always the patient should consume warm food and nourishing food like Krushara. Krushara is nothing but the khichdi. And also Mandapayadi, some Pradhana Mandapayadi diets should be advised. And even in Nasya or Raktamokshana, Lagu Ahara as well as easily digestible diet should be advised. Not heavy food or fried foods, which increases kapha during Nasya Karma, should not be advised. So always Lagu Ahara should be advised during Nasya or Raktamokshana. And but for Basti, it is the normal diet that we can advise, but always see that the patient consumes warm food as well as nourishing foods. Let us understand, because in Panchakarma, when we call it as diet, usually in everybody's mind, we will have one thing in common, that is Samsarjana Karma. Okay, so in Samsarjana Karma, it is usually post, that is after the main Pradhana Karma. Next is Paschat Karma, where Samsarjana Karma is advised, especially in case of Vamana as well as Virechana. This may not be applicable for other Panchakarma like Nasya, Basti or Rakta Mokshana, but these Samsarjana Krama are mainly for Vamana as well as Virechana. So, Samsarjana Krama in Vamana or Virechana, how it should be advised? So, what steps should we follow? So, here it is Manda, Peya, Vilepi, Akrutayusha and Krutayusha, or it can be Akrutamamsarasa and Kritamamsarasa. And lastly, ending with normal diet. See, here I have given the list of uh, preparations, but the table I'll tell you how it should be advised. Okay, so here these are the list of diet or samsajana kramas which we can advise, but it is not compulsory to uh, advise all the diets. You can choose in the beginning Manda and next Peya and then Vilepi and then Kruta Yusha and then Akrita Yusha, or Akrita Yusha and then Kruta Yusha. But Akruta Mamsarasa and Kruta Mamsarasa. Instead of Akruta Yusha, you can use Akruta Mamsarasa based on the uh, individual or the prakriti of a person. And instead of Kruta Yusha, you can advise Kruta Mamsarasa. And later, after finishing all the Samsajakama, the normal diet can be advised. So this is how during or after the Omana and Virachana, Samsajana Krama should be followed with these food articles or the Patta Kalpanas. Why there is need for Samsajana Krama? As after Shodhana procedures, usually and naturally there will be a Mandagni. So here we need to maintain this Agni in normalcy level. So always the Agni should be kindling. So to bring it into normal state, so Samsajana Krama is very useful. So in Shishruta, he says that is after Shosdana, usually and normally there will be Mandagni. But if during this Mandagni, if you consume Guru Ahara, what happens? So it definitely hampers the Agni. Agni further diminishes. So he gives a simile how small fire diminishes when it is overloaded with the large pieces of wood. So he gives a simile that when a fire is burning, then if you overload the fire with pieces of wood, definitely it gets diminishes. So this is how even the Agni after Shodhana is very less. So if you want to maintain the Agni, definitely you should advise very Lagu Ahara, not the Guru Ahara. So therefore, many people, so because why Samsajana Krama is necessary? Because the Mandagni should not be should not happen after the Shodhana procedure. So we have to maintain the Agni to its normal state. Why we need to follow a krama? Because in practice, when we see in practice, definitely there is a lack of practical based knowledge in application of diet regimen in Panchakarma, or there may not be some hands available to prepare and serve the patya or patya kalpana that we say. So usually in patya kalpana there are two, kritana kalpana as well as patya kalpana. Kritana kalpana is for a healthy individual, whereas patya kalpana is for deceased. So in this samsajan krama patya kalpanas there are no hands available to prepare or serve the patya, and the rational and available methods suggested to patients to follow. So there is irrational things which we are adopting. So we don't know. So we are telling some methods to follow to the patients itself, not properly to be advising the samsajan karma. And even the patient or the doctor are, especially the patients themselves, are impatient to prepare the patyakalpana if the doctor advises. Okay, so therefore, this krama is very important to be followed after Virechana or Vamana. So here, even the patients are impatient. So because after they think that only the Pradhana karma is very important, so they follow the Virechana procedure or Vamana procedure. But Samsarjana, they may fail to follow it. So here you need to see that Samsajana Karma is followed even after the Shodhana procedure. So this impatientness is not required during the Samsajana Karma. Now let us understand the Samsajana Karma, in which conditions what type of Samsajana Karma should be advised. So when you see the types of Samsajana Karma, there are mainly three, which are Peyadi Samsajana Krama, Tarpanadi Samsajana Krama, and Rasa Samsajana Krama. So commonly when we say Samsajana Krama, we understand only in terms of Mandapaya Vilepi, but it is not so. See, as I told you, the common food articles or Patyakalapana which we can prepare are Mandapaya Vilepi and Krutayusha as well as Akrutayusha, or Kruta Mamsarasa as well as Akruta Mamsarasa. But even there are other types which we can advise during the Samsajakrama, like Piyadi Samsajakrama, Tarpanadi Samsajankrama as well as Rasa Samsajankrama. So these are the three main types of samsara karma where we can advise to the patient. Let's understand one by one, where Charaka mentions the Payadi Samsajakrama. The aim of this Payadi Samsajakrama is for those who have undergone Vamana or Virechana, and also who have Mandagni after Shodhana Karma, and who have fasted. Not only, see, in sometimes during Snehapan or during Vishramakala or after the Shodhana Karma, the Agni is more sometimes. So it is like after the Virechana itself, the patient feels Mandagni. But during the uh, during or as a Pura Karma, as a Pradhana Karma, even the PRD Samsaja Karma also can be advised. So why we should follow is it increases the Bala. So PRD Samsaja Karma, like many there are payas which I'll give you example and how it should be prepared with a few examples. But as I told you, PRD Samsaja Karma, Tarpanadi Samsaja Karma as well as Rasa Samsaja Karma can be advised. Where it is this PRD Samsaja Karma is indicated. Mainly it is indicated in Shodhita, or where the patient is Durbala, or the patient is Krisha, or where there is Mukta Sandhi Bandhana, or Mandagni, or Krisha Ashaya, Shunya Deha, where the patient is unable to bear the treatment modality or chikitsa. Okay, so in these conditions, Charaka says you can advise Piyadi Samsarjana Krama even after Shodhana if the patient feels weakness, or patient one who is very lean, or who feels like the joints are very loosened up after the Shodhana Karma, or if the patient feels that there is Mandagni, or if there is uh, feelingness of shunyata, that is emptiness in the body, then if the patient cannot withstand the treatment modality, so I will usually after Shodhana Karma, the person feels very lightness, or he may feel lethargy. So likewise, the patients who are feeling all these things, you can advise definitely the PARE Samsajana Krama. See, the order of PARE Samsajana Krama, how it should be. So it should be based on the Shuddhi, and for how many days you can advise this PARE Samsajana Krama. For example, for based on the Shuddhi, like Pravar Shuddhi, Madhyama Shuddhi, or Avar Shuddhi, how Annakala can be divided. So in Pravar Shuddhi, definitely it should be 3 to 3 Annakala, or in Madhyama Shuddhi, it is 2 to 2 Annakala, and in our Shuddhi, it is 1 to 1 Annakala. So how it is 3 to 3 or 2 to 2 or 1 to 1 Annakala, I'll tell you in the next slide. And based on days, for example, if there is Pravar Shuddhi, you should advise Priyadi Samsajakarma for 7 days. If it is Madhyama Shuddhi, you should advise the Priyadi Samsajakarma for 5 days. If it is for Avara Shuddhi, definitely advise only for 3 days. So this should be the order of Priyadi Samsajakarma as told by Charaka or Ashtanga Hridayakara. So this is how the Priyadi Samsajakarma has to be advised in each of these Pravara, Madhyama as well as Avara Shuddhi. Let us understand how it is to be advised. So this here it is a table where I have told you 3 Annakala or 2 Annakala or 1 Annakala based on the Pravara, Madhyama and Avara respectively. So here, as I told you, the dietary kalpana, that is patta kalpana, which are peya, manda, manda peya vilepi, akrutayusha, akrutamamsarasa as well as sadharana anna, or the normal diet that we can call it as. So Pravar Shuddhi, it should be, Pay should be for 3 Annakala, and again Vilapi also should be for 3 Annakala. So this is how Payadi Samsajan Krama has to be advised. For the Pravara, it should be 3 Paya and 3 Vilapi. And for Madhyama, 2 Paya and 2 Vilapi. That is 2 Annakala should give Paya, and for 2 Annakala, Vilapi should be given for Madhyama Shuddhi. Likewise, in our Shuddhi, 1 Paya and 1 Vilapi. So likewise, in the table, you can very clearly see how in Pravar Shuddhi or Madhyama Shuddhi, in our Shuddhi, we can advise Piyadi Samsajana Krama. See, in Pravar Shuddhi, Peya 3 Annakala, Vilepi 3 Annakala, Akrutayusha next is 1 Annakala, Krutayusha for 2 Annakala, and Akrutamamsarasa again 1. It is the choice of a physician to advise either Akritayusha or Akrutamamsarasa, or Kutayusha or Akrutamamsarasa. So after that, Sadhana Nakala should be advised. In our Shuddhi, only one Peya, one Vilepi, and then directly they can advise Kutayusha, and then normal diet can be advised in our Shuddhi of Panchakarma. So this is how the Peyadi Samsara Karma should be advised. Next is contraindication. So Peyadi Samsara Karma where you should not advise. So where little quantities of Pitta and Kapha are expelled out during the Panchakarma therapy, where Pitta and Kapha little, see, we do expect Pitta and Kapha to be expelled out completely. If it doesn't happen during the Panchakarma therapy, then definitely one should advise only little quantity where this happens. So where little quantities of Pitta and Kapha are expelled out, so you should, this it should be contraindicated. Or the person who is addicted to alcohol, or in whom Vata and Pitta are very dominant. So if the Vata and Pitta are very dominant, then don't advise them the Peyadi Samsajan Krama. You can go for Tarpanadi Samsajan Krama. Okay. So let us understand the next one. That is Tarpanadi Samsarjana Krama. So this is indicated where the kapha and pitta are increased, and person who is taking alcohol, or where shodhana is not properly done, or in vata pitta prakriti person, this peyadi samsarjana krama should be advised. But usually what happens is in peyadi it causes srotorodha as it is tarpana. Okay, so see that srotorodha Surto Avarodha will not take place. Okay, because usually Tarpana is nourishing. So definitely nourishing foods will have obstruction to the Srotas or channels. So you should see that Srota Avarodha will not cause by the Tarpanadi substitution karma. So in these conditions where Kapha and Pitta are increased, or person taking alcohol, or where Shodhana is not properly done, or in a person who's where Vata Pitta Prakriti person is present, so you can advise Tarpanadi Samsarjana Krama. Likewise, Rasa Samsarjana Krama, to whom we should advise, where Agni Pradipta is present after the Piyadi Samsarjana Krama. So why this is so? See, for example, this Rasa Samsarjana Krama is not immediately after the Shodhana, that is Vamana or Virechana. It is after the Peyadi Samsarjana Krama if the Agni gets increased again. Okay, so the main intention of Samsarjana Krama is to maintain the Agni. But if by chance, if there is increase in the Agni, that is Agni Pradiptata, after Peyadi Samsarjana Krama, so to prevent the Dosha Prakopa in these conditions, one can advise Rasa Samsarjana Krama. Okay, so mainly Peyadi Samsarjana Krama and Tarpana Samsarjana Krama. So these are the only two important one which should be advised immediately after the Shodhana, that is Vamana or Virechana. Rasa Samsarjana Krama should be advised only if there is Agni Pradiptita after this Peyadi Samsarjana Krama. Usually in Peyadi Samsarjana Krama, Agni may be increased. So to, if it is increasing, definitely to prevent the Dosha Prakopa, you can advise Rasa Samsarjana Krama. So this is how Peyadi, then Tarpanadi, and Rasa Samsarjana Krama can be understood in a better way accordingly. But Rasa Samsarjana Krama, in what order one should advise? So Sushruta clearly says, so first you can advise the Samsarjana Krama which are having Madhura and as well as Tikta Rasa. Okay. Then next is Amla, Lavana, Katu and Snigdha. It should be there. Then Madhuramla Lavana, Madhura, Tikta, Snigdha or Ruksha based on the individual. So this type of order of rasa can be followed for the rasa samsarjana krama. So usually this rasa samsarjana krama is not very much in practice. Not generally everyone knows only the samsarjana krama, but not the Piyadi samsarjana krama or Tarpanadi samsarjana krama, which what should be given. Okay, and when should be given, usually the practitioner doesn't know. So this is how the dietary regimen should be followed during the or after the panchakarma as samsajana karma. What is the benefit of samsajana karma as a whole? be it Peyadi or Tarpanadi or Rasa Samsarjana. Here, as the main intention of doing Samsarjana Krama is to maintain the Agni. Agni becomes Mahan. It means it kindles, the digestion of fire increases or it becomes sthira, stable. Agni doesn't diminish. So Agni Mandata will not take place. So Agni can be maintained in sthira avastha. So it develops the capacity to digest any kind of food if the Samsajan Krama is followed. So it is clearly told by Charaka in Siddhisthana. So these are the benefits of Samsajana Krama. Let us understand various types of Yavago practically and how it should be prepared. So I'll give you some examples so that you can understand how it should be prepared and when it should be given. See, here I have given some of the examples where if there is Vyapat in which cases? Vyapat during Snehapana. Okay. So in these conditions, what type of Yavago can be given? So here it is clearly mentioned Takrasiddha Yavago Syat Gruta Vyapat Nashini. It means here if there is Vyapat due to Gruta, that is during the Snehapana, if you are advised improperly, so improper administration of ghee or Gruta if it is present and due to which there is adverse effect on the Agni, then definitely one has to advise Takrasiddha Yavago. So this is how this Takrasiddha Yavagu helps in eradicating the Guta Vyapat. It means improper administration of ghee. So this is how Yavagu can be. This is one example which I have given. Likewise, even if it is Taila Vyapat, then what it should be given? So here it is told Taila Vyapadi Shasta Sat Takra Pidnyaka Sadhita. So intake of buttermilk with pidnyaka, that is oil cake. So it definitely helps in Taila Vyapat. It means if in during for Snehapana, if Taila is given and if that Taila has adverse effect, definitely this Takrapidnyaka Sadhita Yavago can be given in case of Taila Vyapat. So these are a few examples that I have quoted right now. Likewise, Yusha to specify Vata dosha. So they were Yavagu which I had told you. Likewise, commonly advised Yavagu, see usually in Panchakrama or in Samsajana Krama, only the doctor or physician thinks of Mandapeya Vilepi. But Yavagu and Yusha also are very important as I have mentioned as a Akruta Yusha as well as Kruta Yusha. So Yushas are very important of during the advocation of diet or samsajana krama in as a paschat karma of samsajana krama in panchakarma. So let us understand some of the yushas which specify vata dosha. So yusha of punarnava, rasna, changeri and bala with curd and taila can be given to specify vata dosha. Likewise lashna yusha, patra yusha, masuradi yusha, kambalika yusha as well as kulata yusha can be given to specify vata. So likewise, Yushas to specify which are those Pushpa Yusha, Pallava Yusha, Dhanya Yusha. And to specify Kapha dosha, Mudga Yusha, Mulaka Yusha, as well as Kulata Yusha can be given for Samsajana Krama. And Yushas mentioned in Annavasrotu Dosti. See, as per the disease also, we can plan few Yushas. So generally what we call it as available in the house. Whatever that is available in the house, we advise those. But still, at at the end, I'll tell you, even in house, how a patient can prepare few of the important and easy preparations that can be done after Shodhana Karma at home itself. But these are the ushas to be mentioned or given to the patient even at a institutional setup or in a Panchakarma setup. So Yushas mentioned in Annavasrata Dushti and they are in Annavasrata Dushti Dhanya Yusha, Phala Yusha, Kula Kulattadi Yusha, Mudga Yusha can be advised. Likewise, for common disorders I have mentioned here, like usually the patients uh, are of much of Annavasrata Dushti or we usually think of doshas like vata dosha, pitta dosha as well as kapha dosha. Keeping that in mind, I have mentioned some of those yushas which may be helpful in your practices. So likewise, yushas which are mentioned for rasava srota dushti, it is mudga yusha, then shukadanya yusha, and also chitraka yusha. And yusha is helpful in raktava srota dushti. Usually nowadays rasavaha raktavaha srota dushti are many. So in these conditions, definitely one can use Pushpayusha, Shakayusha, as well as Chanakayusha. And likewise, Medo Vasrutushti. Definitely, this is required after Panchakarma or in Samsajan Karma where Medo Vasrutushti is present. So, in such cases, you can advise Masurayusha or Shukadanyayusha. Yes. So, this completes the methodology of Samsajan Krama, usually after the Panchakarma. So, Purakarma or Beatapa, Purakarma or Pradhana Karma or the Samsachara Karma or Pashat Karma. So where these type of Yusha or Manda, Peya, Vilepi can be advised. So now at the end, what I want to give you is practically, even if you are not able to advise in the Panchakarma setup by yourself as a doctor, you may not be able to prepare all the things, but at least to the patient easily how he can prepare with the available ingredients in the home. So easily these are few preparations where you can definitely advise. So one is mudga yusha, which contains very only mudga and pepper powder, and that is shunti as well as pipali can be added. Usually in clinics we have trikatu, we have hingu, and we have saindava, and in the home turmeric we have dhanyaka. So likewise there are easy ingredients which are available in the either in our clinic or in the market or in the home. They are easily available, and I am telling only those ingredients are the patyakalpanas where you can definitely advise this even after panchakarma. So as samsachar karma you can advise these preparations as patyakalpana. So mudga you should contains only mudga, and also one part of mudga has to be taken, and six part of water has to be taken, and it should be boiled. And during boiling also you can add shunti, uh, pipali. It should be half karsha, and this mudga yaksha has the property of balancing tridoshas, and it is also balya, kanta as well as sweda janaka. And next is Panchakola Peya. So usually only Panchakola is available easily in the market. So you can ask the patient to buy Panchakola. Here the rice, there mudga was taken. Here shali. So what type of shali to be taken? It is always better to take uh, rakta shali. So here 50 grams of rakta shali, to which 15 grams of each Pipali Mula, Chavya, Chitraka, and Nagara. That is Nagara is nothing but the Shunti. So this has to be taken. So practically this would be more very pungent to the taste buds. So in such conditions you can definitely reduce the dose of these ingredients Pipali Mula, Chavya, Chitraka as well as Nagara. And where it should be taken with 16 parts of water and boiled, and the peya should be given as a samsajankrama peya. And properties are deepana, and also they are nourishes the rasadi dhatus. Next is ashtagunamanda. So this is very easy preparation and which has got much beneficial in many of the uh, conditions of agni mandya, because it is deepana as well as pachana. And also it is prana, right, which it gives prana, means it gives energy to the body. Basti Shodaka, it even elevates Jara. Aruchi, you see, even after Panchakarma, many times the patient may feel Aruchi. He may not be able to take food. He doesn't feel tasty to, he doesn't feel much tasty. The food, whatever that he takes, he doesn't feel tastier. So in this condition, definitely Ashtagoda Manda is going to be one of the good preparation so that you can advise, because even it contains both Shali as well as Mudga and Shunti Maricha Pipali, which is Trikato. Then Hingu has to be taken, and also Dhanyaka. Dhanyaka is nothing but the coriander powder, which is available easily in the market. Then, or in the home also it is available. So Hingu is also available. Saindavalamana, it is also available. So these are the easily prepare, uh, easily preparable Upatya Kalpanas which we can advise after the Panchakarma. So this is how it is Deepana, Pachana, Pranada, Bastishodaka, Jara, Aruchi, and it also nourishes Rasa as well as Raktadhatu. Even in anemic conditions, this Ashtaguna Manda can also be given. Here, you need to concentrate upon the parts of water as well as the ingredients that you take. So, for one part of these all things, 18 parts of water should be taken for Ashtaguna Manda. So, with this few examples, let me conclude the speech or this talk. And but some general diet guidelines which I would like to focus is always after the panchakarma or diet as a panchakarma, after the panchakarma during samsajana karma, always brahmana or nourishing type of food, that is tarpanadi samsajana karma, are very helpful. But use of milk may be avoided, but use of ghee and meat soups can be given. But focus should be to restore the strength or to restore the immunity or to restore or tissue building, or it means nourishing food should be given. And always give warm, freshly prepared and easy to digest food. And definitely one should avoid viruddha ahara after the Panchakarma, that whether be it Shodhana, like Vamana or Virachana, or even during Basti, definitely avoid Viruddha Aharas. And always one should follow Patya and as well as Apatya based on dosha as well as procedure that you adopt. And see that one patient, you should maintain the hydration. So, always, usually, what is in our mind is Ganji. It means nothing but the Manda. So, they are the good preparations where I have not told you those preparations usually because it is easily practiced nowadays. But now, as a practitioner, I have concentrated much on the other preparations. So here, to maintain hydrations, those payas are very useful, like ganjis. So as a concluding part, definitely, diet is an integral part of panchakarma, and definitely it promotes healing, and it also helps in recovering, and also it helps in balancing the doshas. And but as I told you, the diet during panchakarma or after the panchakarma, it should be personalized as per the individual's prakriti and therapy that you advise. It must be definitely personalized. It should not be generalized. Usually after panchakarma, we do advise common dietary regimens which should be avoided. So according to the patient prakriti as well as the roga, as well as rogi and his bala. So the diet should be advised. And in Samsajana Krama, all measures should be focused towards protection or preservation of Mandagni, because definitely after any of the Shodhana Karma, the patient will have Mandagni, and especially after Vamana as well as Vinachana, patient will have Mandagni. So it should be seen that there should be preservation of Mandagni. And food which you advise should have deeper and Pachana properties. After advising deep and Pachana properties, afterwards only the foods which you are preparing should have deep and Pachana properties in the initial stage, and later you can ask the patient to shift slowly to normal diet. Okay, so with this, I definitely I can say that I have given much of the information, or uh, even though it is little information, but it is definitely helpful for your Panchakarma practice, where the dietary regimen which you can follow in your practices. With this, I thank everyone for giving me this opportunity and to be and making me as a part of your uh, team. And and definitely I hope I have justified my presentation uh, during this time. So I definitely thank all the my seniors, those who have encouraged me, uh, be it as Savitri Madam or Mahesh sir, Chandrakant sir, or Praveen Patil sir, or all the my seniors. Definitely, I thank you once again for giving me this opportunity. Thank you, Ananta.
Thank you, Dr. Prabhu. It was really informative, very crisp, very in detail, and it was so easy that we could the preparations was so easy that we could prepare at our clinics and something like at kitchens. So thank you for such a detailed information. And now it's time for question and answers. If anyone has doubts or anything to ask Dr. Prabhu, they can unmute themselves and ask questions. Anyone? It was really very simple. Thank you. It was very informative.
Thank you once again, madam. Thank you.
Anyone would like to ask any questions? Kindly raise your hand. Any questions like I think it was so understandable that